Thousands of years ago, surviving an injury was far more dangerous than it is today. Imagine breaking your leg. Not in a modern city, but 50,000 years ago. There were no hospitals, no doctors, no ambulances, no painkillers, no antibiotics. If you were seriously injured, survival wasn't guaranteed. A deep cut could become infected. A broken bone could leave you unable to move. Even a small wound could become deadly. Ancient humans lived in a world filled with danger, predators, accidents, harsh weather, and constant physical challenges. Yet somehow, our ancestors survived. Not for years, but for thousands of generations. So how did humans stay alive before modern medicine existed? The answer might surprise you. Long before pharmacies existed, humans turned to nature. They observed plants, roots, leaves, and tree bark. Over generations, they learned that certain plants could reduce pain. Others could help wounds heal. Some even helped fight infections. This knowledge was passed down through families and tribes. Many of the medicines used today actually originated from natural substances discovered long ago. Ancient humans didn't understand bacteria. They didn't understand germs, but they understood experience. And experience taught them what worked. Surprisingly, ancient humans were capable of far more than most people imagine. Archaeologists have discovered evidence of ancient medical procedures dating back thousands of years. One of the most remarkable examples is a procedure known as trepanation. Trepanation involved carefully drilling or cutting a hole into a person's skull. It sounds terrifying, yet researchers have found skulls showing clear signs of healing after the operation. This means some patients survived for years afterward. No modern anesthesia, no modern surgical equipment. Yet somehow these ancient procedures worked. Scientists still debate exactly why trepanation was performed. Some believe it was used to treat head injuries. Others think it was intended to relieve pressure inside the skull. Whatever the reason, it reveals an extraordinary truth. Ancient humans were already experimenting with medicine. Broken bones provide another fascinating clue. Archaeologists have discovered skeletons with fractures that healed correctly. In some cases, individuals suffered severe injuries that would have left them unable to hunt or gather food for months. Yet they survived. This could only happen if others cared for them. Food was shared, protection was provided, and injured members were not abandoned. But survival wasn't just about medicine, it was about people. One of humanity's greatest advantages was cooperation. An injured animal is often left behind. Ancient humans did something different. They cared for one another. Some archaeologists have even discovered individuals who survived into old age despite disabilities that would have made independent survival nearly impossible. This means entire communities helped them live. The tribe became humanity's first healthcare system. Knowledge was shared, skills were passed down, and every generation learned from the experiences of the last. Ancient humans didn't survive because they had advanced technology. They survived because they adapted. They observed nature. They learned through trial and error. They developed early forms of medicine. And most importantly, they looked after one another. Long before hospitals existed, humanity had already discovered something powerful: the strength of community, the ability to learn, and the determination to survive. Those simple advantages helped our ancestors endure one of the most dangerous periods in human history. And without them, none of us would be here today. Together, we survived.